So, ladies and gentlemen, thank you for staying still with us, although the time is going and the air is not that fresh as at the beginning this morning. So, then asked me to report maybe on a little bit success story. We consider this as this from Germany. Today I made a comment that Germany has some problems here and there, but there is one area which we think we made a big step forward. So he asked me even to put this on the web, and Bob was so nice and helped with this. And the main thing is here, it's Deutscher Ärztetag, is the Physicians' Council who make an important decision based on history which is going back 25 years or so. So this is the German Physicians' Council. They make a vote, and in this vote it was on pain. For the first time, it was on the schedule of the German Physicians' Council, and what they vote for is to lower the borders for all patients in order to get fast access to pain-related healthcare and optimal pain therapy. To consequently consider pain units and pain centers in the planning of demand. So this means gets better financial reimbursement. This was not the case at all. In Germany, the doctors who treat pain were not adequately compensated by money, and when they start, shortly after this, they stop their work in it. So this will become a change. For us, and this I highlight here, is to improve acute pain treatment in hospitals by the introduction of a quality indicator pain in the quality management system. And this is a breakthrough for us, and never we talked about this. To strengthen the pain competence of the physicians via educational programs is another one, and to support health services research, especially projects in pain medicine. So nothing comes from heaven, and when we come to this, it needs some work before. And I would like to tell you a small story, starting in already 1988 with some milestones. And we started with our own studies in endoscopic surgery. There was an agreement between the societies of anesthesiologists and surgeons. I come to this in a minute. First APS was started in Cologne, in the hospital which I was affiliated to. We came up with recommendations for the management of pain. We did a survey because surgeons, you can only convince surgeons by data, otherwise they neglect feelings. So the story about this is a surgeon said to me, Eddy, come with me, walk with me on the ward, and when you hear a patient crying, then we have a problem in pain. This was the meaning, and before we started, I said this cannot be. But therefore we need this kind of surveys. We started with a guideline, founded a acute pain working group within the German chapter for the study of pain, and we started with our first symposium. And imagine or not, already in 1988, I wasn't even at that hospital, one of the persons who was with us was dead. And another person who you all know is a surgeon, is named Henrik. And both of them contributed significantly to the development of pain management in Germany. This is how it all starts. This was 1988, and we were at the castle in Meran, and were distributed in some working teams. And even Noel Belzak, whom you all know, was with us, and other famous persons at that time. And the person who invites us, he was not a crazy surgeon only, but he was a very open-minded Bavarian surgeon who said, surgery is more than doing operations. We have to take care about patients. And he invited the people for a pain conference. A surgeon invited all the... I was in charge to make a literature survey and look who were the famous people. I was not in that field at that time at all. I came by Hans Treudel into that field. So what was the basis for this was the development of laparoscopic surgery at that time. So he was the first in Germany who operated the gallbladder with endoscopic procedures, and the goal was less pain and shorter convalescence. And he asked me, Eddy, help me, how can we show this, that it's really the case? And we did studies on that and so on. So laparoscopic surgery helped develop this field. So in 1992, we discussed with surgeons and anesthesiologists, discussed and talked to each other, and come up with different models to put all the anesthesiology, all the pain management into the anesthesiologist's part, delegation of parts, delegation of the complete service, pain therapy to the anesthesiologist, or establishment of an acute pain service consisting of anesthesiologists and surgeon. It was a major step, and this was adopted, this model, and this was the reason why in 1993 we started with the first APS in the clinic of Hans Streudel under the guidance of myself. So immediately we came up with an expert-based guideline, and other people call this GOPSAT, good old patients sitting around the table, good old bodies sitting around the table. But still, we had something in our hands which give a guidance to the surgeons. Although we all know that this is it's not a high quality, but it's GOPSAT. Yeah. So then, as I mentioned, this situation in postoperative pain management in Germany, I was happy to recruit 1,000 hospitals. This is a number. We have 2,000 hospitals in Germany filling out this questionnaire. And from the survey and the studies, we know that physicians consider acute pain as highly relevant for their daily practice. The theme acute pain from the physician's perspective is also of high 90% significance for the patients. They say this, but also that for bigger than 50% of all surgical patients still experience severe means VIS greater than 5 pain in our hospitals. So we have obviously a problem. Everybody, okay, this is a problem. They will never say, Eddy, go home, this is your problem, but this is our problem. So we put this, of course, to the press. This is just an overview, and of course, by publishing this data, the press come and it was published in every journal. So the message, one message is to you who are also on the way to help changing systems. This is a good tool. They don't like me very much at that time, of course. But so we go on further. This is S2. It's a step further guideline. It's a consensus-based guideline with some evidence. And by also foundation of the working group, we started our first meeting with surgeons and for surgeons, akuter Schmerzen, chirurgische Schmerzen, acute pain in daily routine of surgery. And we did this every 2 years since 1999. We came up with recommendations for acute pain management. This, for what we know, we put this on a disc, we sent it to everybody, and we came up with a book, which I had the chance the opportunity to edit. We came up with a curriculum to educate, especially surgeons. It was very well accepted by the DGSS and others at the borders of physician chambers, and 10 times a year. It was well adopted, this thing. So we are here, and the story goes on. There was a foundation of Prospect, a foundation with a foundation of the CIS as a working group on pain within the surgical society. And because when I started with this, to reach only anesthesiologists was not enough to make a change to the system. We need to go to the surgeons and to convince them, to talk to them. So we founded this, and QUIPS, we have heard a lot of this also today, was helping us a lot in recognition of our problem. Also the expert standard of nursing and a European trial, which we did, PATHOS is called. Then internationally, the foundation of the APSIG, a foundation of the anesthesiologist and surgeon. The first certificate of pain-free clinic and pain-free hospitals was done. we came up with a guideline, S3 guideline now, evidence-based patient information, evaluation, and this recommendation by the chamber. And Prospect was already mentioned. This is still active since 2002, so 12 years now. This was the founding people. And when you go to the website, this was when we started. Now we are just working on C-section and prostatectomy, which come up, and some actualizations which come. What is important for that group and what makes this success of the Prospect is that there is a strong methodology, and all those of you who visited the site, you can find every detail and the basis why we recommend this or not. So this is QUIPS, and it even come to the Deutsches Ärzteblatt. This is a journal which every physician gets free and reads. So QUIPS was very helpful in creating awareness for our problem. And we have heard about this today. This is a central database, and the important thing is that we have a constant feedback for those who participate, and the feedback is evaluated, and this helps, is transparency, this helps make an improvement. We heard today from Dr. Koma that especially in the clinical gynecology, there was an improvement even by presenting the data to them. And it goes on with QUIPS and even in the pain-out program, which are not necessary to mention anymore, but this all helps, because also pain-out goes in Germany, and Meissner, as a promoter of this, stayed at several meetings and explained his data. Also because all you know that the pain management has a lot to do with nurses, and without the nurses we cannot change anything. And also the nurses started to make an expert standard on pain management, and this helps, and when it goes into the guideline. The PATHOS trial make obvious that we have structural problems in education, in patient information, in therapy. Only 12% have protocols in European hospitals. And measurement of pain, and this was 2005, measurement of pain only in 25%. So big variances in responsibilities in the different countries. We find out here France, Belgium, Portugal, it is mainly in the hands of the anesthesiologists, and in Germany, Spain, Switzerland, it's mainly surgeons who do pain. So to identify what is the target of our education. So of course also our foundation in Sydney helped to promote the field in Germany. When we talk about this, they say, oh yes, Germans are promoting and looking for help from other countries to make it better. Helpful are also certificates. And maybe this is a typical German behavior. Germans like certificates, and which you can put on the wall and so on. And this is a certificate which I developed together with an organization. It's called Pain-Free Clinic. So it's a certificate on quality management in perioperative pain management, and it was adopted by the different hospitals and by advertisement of this organization, TÜV it's called. So I went to give several talks and said this is possible for every hospital. Please come and take it. Helpful at the back of all this was the German guideline. So this was an evidence-based, consensus-based guideline on the highest level. This was 2006, 2007. As you can see here, these are general things: patient information communication, measurement documentation, pain treatment modalities in general, organization, and some specific aspects. And then we go through all head and neck, and so thorax and the other things, always general, pre, intra, post-op. It came up with 250 recommendations. It took us, I feel, half of my life, but it was several years which we work on it. So patient information and communication is also to translate this information for the patients. So we come up with evidence-based patient information, which is free on the web, and every hospital can take it and can use it. Then there was the development of two relevant concepts, the certification in both. This was the first initiative of the pain-free clinic. This was started by us and by the surgeons. This was a certificate in quality management and acute pain therapy. And there's another parallel, looks similar, it's pain-free hospital. It's Dr. Meyer, Professor Meyer, who started this just by chance, nearly in parallel. When we would have talked to each other before, we would have only one. So there was a little bit competition, which helps in that time to become better, both of us. So the reason, the rationale behind is that we would like to avoid problems at the intersections. And this is what is, it's acute pain management in let us say 90% or so is organization and talking to each other. So both of these are quite successful. This is from 2011. You can see here, this is surgery. This is a conservative treatment. You can see here there are nearly 200 hospitals who adopted this certificate. Not that much in conservative treatments. The opposite is here in the other pain-free hospital movement, but similar. So in total, we are in Germany, on our way, let us say. When they still like certificates, then we go on with this. Helpful was also the pain movement from the IASP, Global Year Against Acute Pain, in October 2010. And as you can see here, it was for surgery, injury, childbirth, and acute illness. I come nearly to the end of this mention of the different steps. We heard about Gerbershagen's story about evaluation of QIPs, and it was astonishing for most of us and also the authorities that minor operations, so-called minor operations, still make the highest pain. And helpful also was a HTA report at nearly the same time, saying that about still 60% of the clinics, the patients suffer from moderate to severe pain. So there was not that much change. And then in here nearly the 8th, so 16 years of Congress is behind this, we say pain is an ideal parameter for the evaluation of quality in hospital care for patients and should become a leading parameter for quality control to be introduced by law. And this is where we currently are. This is the reason for this. I think everybody understands this and adopted this, and this is the basis behind this paper. And there was a vote then to improve acute pain management in hospitals. I just mentioned this, but what is behind the implementation of a structured acute pain management and quality management systems in the hospitals? This is the next step, which we ask for. Consideration as an interdisciplinary quality indicator. In Germany, we try to move from sectors to across other sectors and no longer have sectorized medicine, but a continuum. Just we heard about acute to chronic pain. It is a continuum. And it should become mandatory for a constant improvement of pain-related patient care in hospitals. So saying this and having this vote immediately goes into law. So the next step, when we'll be here next year or so, I hope we will have the quality indicator there. And then finally, you maybe can find some signs on the Autobahn, on the freeways that says this is pain-free operations, next exit, please. So thank you very much for your attention.